COVID-19 is an infectious disease, which means it is very easy to spread to other people. According to the Centers for Disease Control and Prevention, coronavirus spreads from person to a person when people are in close contact with another one. The virus spreads through respiratory droplets when a person coughs or sneezes. The droplets can land in other people's mouth, nose, inhaled into lungs, or transferred to your mouth or nose or eyes through your hands. If maybe you moved around and you touch things or objects, and then that virus, you get it, and then maybe you try to rub your face with your finger or your hand, it will be easily transmitted to you. Let's think about the prevention, the precautions, the steps that they have taken to ensure that they prevent or protect people from getting COVID-19. So, one, we can talk about social distancing. This means stay at least 6 feet apart from the other people. This is social distancing. Well, I'm trying to mean keep a distance between the two people or the people around you to ensure that at least there is a distance of like 6 feet from one another or apart from a person around you. 2. Stay at home as often as possible or limit movement or visits. So we are trying to encourage people, more especially the community of refugees and immigrants. I will not stop saying that because we are refugees and immigrants. According to cultural beliefs, hospitality is one of the way in respect, and people keeps visiting each other, and being that we have limited families around us, so visiting our friends, visiting other people around the community we are living, it is so essential. But at this point, we are encouraging everyone, all refugees, immigrants, to make sure that please stay at home. Don't limit your movements. Don't keep visiting your friends. Don't if you don't stay together, please, you can use any other way of communication to keep that friendship or that relationship moving by either calling on WhatsApp video, Facebook Messenger, Twitter, Instagram, calls, messages. Please use any other ways to ensure that you stay where you are until this comes down. Third, avoid shaking hands. It is the way of respect in some cultures, more so communities of refugees and immigrants, but you can still honor greetings in another way. Please, I know that shaking hands in the community of refugees and immigrants, this is very essential. It's very important, and it shows a huge respect, and you need to feel somebody. But at this point, please, let's limit that. Let's not do that for now. If you are not staying with somebody in the same house, please don't shake hands. But we have very many ways of greetings. I can give you this. If I do this, it's just enough. It's just enough. That shows that you have greeted me. Or we can humble ourselves. Culturally, you can humble yourself like this, and somebody will also know that, and that will make sense still to be part of respect. Also, you need to wash your hands often with soap and water for at least 20 seconds. If soap and water are not available, you can use hand sanitizer that contains at least 60% alcohol. However, soap and water is the best. What are we trying to mean? I'm trying to mean this: wash your hands at least 20 seconds with soap. This is what I'm trying to mean, and I hope you take this serious. Also, avoid touching your face, touching your eyes, nose, mouth with your hands. What do I that mean? Touching your face like this, when you have not washed your hands. Touching your face, if you are carrying the virus from outside or anywhere, it may remain in this hand. So it is very important to wash your hands. What do I mean? I mean this one. I've put here the cross. This cross means no. Let's stop. Stop it. That don't touch your face. Please try to take caution of this. don't touch it, because once you touch it, any virus that is in hands, it will be easily transmitted today to your body. Okay, always cover your coughs and sneezes with a tissue, and immediately wash your hands with soap and water after you cough or sneezes. So once you sneeze or please cover it. You can use even your coat to cover like this before you sneeze or you cough. You can use anything. You can even do like this. Please make sure that when you are coughing, you're sneezing, make sure you cover it so that this virus doesn't move out to other people. Always remember to clean and disinfect all surfaces that are touchable, often like tables, doormats, light switches, countertops. I'm trying to mean this. This is a microwave. Most of people use microwave. This is a fridge handle. This is the table, and this is door knob. So if you can get your computer and then you make sure that you clean this, making sure that you get your phone. Now clean it, wipe it with any clothes or any sanitizer that you have, or cleaning materials that you have. Okay. Medical face masks are in short supply. It would be the best, but they're in short supply and are recommended, are more needed at hospital than in people's home. However, it is now recommended that you wear a cloth face mask when going to public places like grocery stores or pharmacies. Cloth face masks can be made at home from old clothes or bandanas. This is not to be used instead of social distancing, which means it is most important to stay at least 6 feet away from people at all the time. So we can still make our face mask from our home, from all the clothes that we have. I'm sure everyone has it. Yeah, but still, having that doesn't mean that you have to be close to other people. Still, you can stay 6 feet apart from other people. Truly, the best thing that everyone can do is to stay home as much as possible and stay at least 6 feet away from other people who do not live in your home. You already know that many places in your community are closing because of coronavirus. And the latest order from the governor of Illinois, is that everyone should stay at home except for essential activities, and all businesses should close except for essential businesses. Essential activities are as follows: seeking medical services or getting medical supplies and medications, buying groceries, home supplies, and cleaning products. Outdoor activities like running, walking, biking, as long as you are staying at least 6 feet away from others who are not in your immediate family. Work at essential businesses, like people who are working in hospital and in pharmacy. I think they are allowed to do that. They are allowed to move out and work. Caring for or transporting a family member, a friend, or a pet. That is essential. You can still keep doing that. Essential businesses are as follows according to Chicago government: hospitals and pharmacies, grocery stores, food banks, convenience stores, pet supply stores, take-out or delivery restaurants, hardware stores and plumbers, banks, mailing and shipping stores, laundromats, home care for seniors and some other people, community organizations for food, shelters, and social services, and more listed on Illinois government website. So those are the few things that I've come up with, and we hope that you make use of all this at this moment. Please take care of it. Be sure. I'm Emma Yaka, refugee from Uganda, who has been working with refugees for quite a good period of time. I understand refugees, and me being part of them, it's really very important. that we bring information to people to make use of it and help them be prepared and protect themselves from this. I thank you very much for listening. I'll keep bringing more events as we keep moving. We are looking for all creative ideas to ensure that we keep people safe from this COVID-19. I salute you, and please, we need your help. We call for your encouragement, your advices, your creative ideas to help the community stay safe. Thank you very much. Really
and the good news is that everyone is a potential solution.
Everyone is a potential solution.